Okay, now you know that to perform different functions, the organs of the human body produce movements. Simple. For example, we want to take a glass of water from the table towards the mouth, this movement must be produced. In the same way, the heart moves to produce it, to perform its function, and so on. Now, these movements are being given different names or nomenclature, and the movements occurs at different joints. For example, this is one joint, this is one joint, wrist joint, elbow joint, and knee joint, etc. And the movement, all the movements must be considered from anatomical position like this. You are standing and with the palm of the hand facing forward and so on. You know already what is anatomical position, but the movements must start from anatomical position. Now these different names being given to the different movements is being called terms of movements. And from today onward, as a medical student and as a doctor, now you will use these words. Okay, and the first word that is being used over here, okay, for movement, this is first one is flexion and extension. Now, look, the flexion is the flexion is flexion, to flex. It's the bending movement. Look, this is anatomical position, and you concentrate at this joint. Look, it's the bending movements. In this movement, the angle of the joint is being reduced, and it usually brings the two anterior surfaces nearer to one another, and it takes place in the sagittal plane, and it usually takes place in the anterior direction except the knee, where it takes place in the posterior direction. So this is the definition of flexion: bending movements, reducing the angle of the joint, for example over here and this, and brings this anterior surface nearer to one another, and usually take place in a sagittal plane, and usually take place in the anterior direction except the knee, where it takes place in the posterior direction. This is all bending movements. Now let me say, this is flexion, this is flexion of the neck, and but in the knee the flexion is in the posterior direction, you already know. All right, now the second one is the extension. Extension is the straightening movement. Look, this was the flexion. Now this straightening movement from flexion at this joint, let me say this joint, this straightening movement in which the angle of the joint is increased, and it take the two posterior surfaces nearer to one another, or it take away the two anterior surfaces away from one another, and it takes place in the sagittal plane, and it usually takes place in the posterior direction except the knee, where the extension from flexion is in the anterior direction. Okay, this is the extension. And in fingers of hand you can say, look, this is flexion and this is extension. At wrist joint, this is flexion and this is extension. Now a trunk, this is flexion and this is extension. Alright, one movement of the trunk is like this. This I will explain later on. Okay, now the next term is adduction and abduction. Addition, bringing nearer to one another. Now in this moment, adduction, look again in anatomical position, that let me say the upper limb, or the shoulder joint. This is the midline. Any movement look from towards the midline, this is called as adduction. Movement of a part of the body towards the midline, for example, coming from this to this is called as adduction. And taking away from the midline, this is called as abduction. Going away from the midline, this is called as abduction, and towards the midline, this is called as adduction. Now look at the shoulder joint. This is abduction and this is adduction. Okay, and then this is abduction, and then going back again coming to this side, this is called as overhead abduction. Of course, now the limb is being coming more nearer to the midplane from lateral side, but again it is being called as overhead abduction, not adduction. This is abduction, this is overhead abduction, then this is adduction. All right, and look in fingers of hand. Look, this is the middle finger. The axis passes through the middle finger, and the movement of the fingers towards the middle finger, all the movement of the fingers toward the middle finger, this is called as adduction, and movement of the fingers away from the middle finger, this is called as abduction. This is, look, spreading, this is abduction. Bringing together, this is called as adduction. But look, now this ring finger, let me say, if it moves like this, it is moving toward the midline, but it is moving away from the middle finger. That's why it is called, not called as adduction, but it is called as abduction, because over here the axis is being considered at the midline. And then at the foot, the line of axis passes through the second toe, not the middle, the second toe. That's why the movements of the finger or toes in the foot toward the second toe, towards the second toe, that is called adduction, and away from the second toe, that is called abduction. In the same way, the movement of the great toe toward the second toe, that is called as adduction, and away from the second toe, that is called abduction. This is in foot. Now, coming to the thumb, you look, this is the anterior surface of the finger, and this is the posterior dorsal surface, or palmar and dorsal. And in thumb, now look, the anterior surface is now facing medially, and the posterior surface is facing laterally. That is, the surfaces are being at right angle to the surfaces of the other fingers and palm of the hand. This is necessary for this opposition movements, what is very important movement for writing, for stitching, and for many other things, because without the thumb, the other fingers become useless. This opposition movement of the thumb is very important functionally. Alright, now look, because the surfaces of the thumb are at right angle to the surfaces of the fingers, that's why the movements of the thumb are also at right angle to the movements of the finger. Now look, the flexion of the fingers, this is flexion, and look, this is flexion of the thumb. Across this, look, in this direction, in this axis, while the thumb, this is flexion and this is flexion. To make a fist, all the fingers are being flexed. Now look, this is extension, and you know this was flexion and this is extension. Flexion and going like that. This is extension of the thumb. Now, adduction. Look, this is the middle finger. This is adduction of the thumb, and coming in this direction, this is abduction. Adduction and abduction. Flexion and extension of the thumb. Again note, this is all flexed and this is all extended. This is all adducted. This is all abducted. Or individually. Flexion of the thumb, extension of the thumb, adduction and abduction. This is the movements of the thumb. Maybe a little bit complicated, but if you properly think over it, you will understand. Alright. Then is the word rotation. Rotation means, look, movement of any part of the body. movement of any part of the body around around its long axis. For example, look, this is the thumb, this is its long axis. Movements of any part of the thumb along or around its long axis, in this way or in this way, this is being called as rotation. It is simple. Rotation to move around its own long axis. That is called as rotation. Okay, before doing that, I told you one point. Look, this is flexion of the trunk, this is extension. Okay, and this is abduction and this is adduction. But the bending of the trunk on the lateral side, where over here bending occurs, so it comes now in abduction as well, because this part is being moved from away from the midline, but the midline by itself is being moved toward that side. That's why to call it as abduction, it is not correct. So people say that that is lateral bending or lateral flexion of the trunk. Instead of calling it abduction, people call it as lateral flexion or lateral bending. Okay, then rotation are of different types. Look, this is medial rotation. Again, from anatomical position. Look, this is anatomical position. The medial rotation is the movement of the part of the body in a way that the anterior surface now faces medially. This is being called as medial rotation. Now this was anatomical, this is anterior, this is posterior, and now you move it like that so that the anterior surface faces medially toward the midline. This is medial rotation. And the movement from the anatomical position and in a way that the anterior surface faces laterally, that is being called as lateral rotation. Look, anatomical, this is anterior, this is posterior. Now when it is being rotated in a way that the medial surface now faces toward the midline, this is medial rotation. And when the medial surface, and then when the limb is being moved in a way that the anterior surface faces laterally, that is being called as lateral rotation. Okay, and then one another word which is used for rotation, that is called as circumduction. Circumduction again means this circular movement. I think the circumduction and rotation, it is almost one and the same. To move around its own long axis, this circular movement or circumduction and rotation. But in anatomy, it is being described like that the movements in sequence of flexion, extension, adduction and abduction, then it is called as circumduction. If you do it in this sequence, flexion, extension, adduction and abduction, if you do it in this sequence, that is called circumduction. Otherwise, I think circumduction means circular movement around its own axis, which comes like the rotation. But anatomy, it's written like that. Okay. And then the other word, term of movement, it is being called as supination and pronation. Look, again, this is the anatomical position. And you know, supine position is to lie down on the face facing downward. That is supine position of the human body. While in supination, we specially use it over here for the upper limb. Look, in which the arms, the forearm and the hand, it moves toward the medial side, that is medial rotation, but up to the extent so that the anterior surface now faces posteriorly, that is being called as pronation. The movement from anatomical position, medial movement or medial rotation, up to here, it is only called a medial rotation. But if you do it more and the anterior surface comes posteriorly, that is called as pronation. While in supination, again, from this movement, lateral rotation like that, so that now the anterior surface again comes anteriorly, that is being called as pronation. But if you continue it more than that, then it becomes lateral rotation. But the movement from the pronation up to the extent that the anterior surface comes now anteriorly, which was posteriorly, now it is supination. But if you continue this rotation more than that, then it becomes lateral rotation. I hope it's now clear. Alright. And then another words which are being used, that is being called as inversion and eversion. This inversion and eversion, these are the movements for the foot. Now look, again, in an anatomical position, your foot is like that. And you already know this surface is called as dorsal surface and this surface is called as plantar surface. Although this is the superior, this is the inferior, but originally this is the anterior and this is the dorsal, or this is the ventral, this is dorsal. But now in this position, Allah has made it like that, that the foot is touching the ground and this ventral surface is now facing inferiorly. So instead of calling it inferiorly, we call it as plantar surface and this is dorsal surface. That's why at the ankle joint, also note this point, the movement of flexion and extension that occurs at the ankle joint, we don't call it as flexion and extension, but at the ankle joint, at this joint, the movement, this is the plantar flexion and this is the dorsiflexion. We don't use the word as flexion and extension, but the movement towards the plantar surface or towards the sole of the foot, that is called as plantar flexion, and again and toward the dorsal surface, that is called as dorsiflexion. Now what is inversion and what is eversion? Look, this is the foot on the ground. You turn it the foot like that, so that the middle border of the foot is off the ground and you are standing only at the lateral border and the inferior surface is now facing medially. This is called as inversion of the foot. This is anatomical position. The foot is on the ground. Now you lift the middle border of the foot in such a way that now the middle border of the foot is off the ground and the lateral border of the foot is on the ground, and the middle surface and the inferior surface or plantar surface is now facing medially. This is called as inversion. While eversion is again the movement of the foot in such a way that the lateral border of the foot is off the ground and you are standing at the middle border and the plantar surface is now facing laterally. That is being called as eversion. This movement is usually at the foot. But note the point that the plantar flexion and dorsiflexion, it occurs at the ankle joint. But note the point that the inversion and eversion, it never takes place at the ankle joint, but it takes place at the smaller joint, subtalar and associated small joints. I hope you understand. And then another word is protraction and retraction. Pro means forward, you know. The forward coming of any part of the body, that is being called as protraction. And retraction is the going back of any part of the body, is being called as retraction. And this is being specially used for the lower jaw. Now look, normally the upper teeth are in front of the lower teeth. But when you bring the lower jaw more forward in a way that the lower teeth comes in front of the upper teeth, that is called as protraction. And going back from this position again, so that this upper incisor come in front of the lower incisor, that is being called as retraction. This is also being used for the scapula when the scapula comes forward and backward over the thoracic wall during movements of the upper limb. Over here also the word protraction and retraction are being used. Okay? Alright. Now from today onward, now you will use these words during if you want to describe any function or any movement of the human body. Now as a doctor and as a medical student, whole life you will use now this word. You will not use the simple English word, and I hope you understand. Okay, thank you very much.